Dr. Pinzone joins us now, and Dr. Pinzone, obviously, thank you for seeing Michael. I want to yield the floor to you in terms of what you were thinking about and what you found.
Yep, well, thank you very much for having me on. And I just want to say that in so many instances, we noticed that the guests on this show are often kind, courageous, and none more than Michael. So it's really great that he's here because his story is so common. So I'll tell you that in the normal development of boys, fully 50% have some breast growth between the ages of 12 and 14. Now, in 70% of those cases, it just goes away. But if you do the math, that leaves 15% of people, of boys, with some degree. Now, most of that, the vast majority of that is not really noticeable. If you stared at somebody at the beach, you might be able to notice it. But in Michael's case, this is an advanced case, and that is only a couple of percent of boys. But frankly, boys should be having physicals every year. This should be picked up, and in most boys, watched. If there is tenderness, there is some medical treatment, but there's really nothing to stop it that we know of. On the other hand, we do have some treatments, but it's important to recognize that in Michael's case, we did a full battery of testing. We found no underlying hormonal cause, which is really reassuring. And so he has true pubertal gynecomastia, meaning breast growth that occurred during puberty, and that's it, which is good news. Yeah.
So does it feel good to at least hear your doc saying we have good news?
Yeah. Awesome.
Now, let me just say that it's important to realize that there can be medical conditions associated with this. So in adults, adult men with gynecomastia, 25% have pubertal gynecomastia, that is breast growth during puberty, like Michael does. In 25%, we really can't find an underlying cause. And in the remaining 15%, it could be any number of medications, including marijuana. It could be pituitary disease, liver disease, kidney disease, or even tumors such as testicular or adrenal tumors. That pretty much encompasses what causes adult gynecomastia, and it's concerning when the onset is in adulthood.
And you mentioned things that are concerning. I'm so glad to hear that those concerns are not present in Michael's case, but that doesn't mean that there is not hope, Dr. Ordon, in terms of the excess tissue.
Michael, you visited with Dr. Pinzone, and he gave you a clean bill of health. So this becomes a surgical treatment to take care of this for you. And I'm so touched by you and your mom. You reached out to us that I reached out to a colleague of mine, Dr. Dennis Hurwitz, in your area, board-certified plastic surgeon, that literally wrote the book on this type of surgery and body contouring, and we have him here on tape with a special message for you.
Hi, Michael. I'm Dr. Dennis Hurwitz, board-certified plastic surgeon and clinical professor at the University of Pittsburgh, pretty close to where you live. The doctors have told me about your story, and I'm touched. I want to help, and as such, I've devised a unique surgical plan that utilizes minimally invasive techniques to rid you of your problem. Looking forward to seeing you in Pittsburgh for your appointment and your upcoming surgery very soon.
Thank you so much.
Thank you.
Thank you.
You're so welcome.
Thank you so much. Thank you too, Doctor.
Thank you.
Oh, you're welcome.
Feeling some hope now?
Yeah, definitely. This is the best news ever. 13 years struggling.
And listen, caveat, Michael, we lined you up, but I need to also tell you that you need to do your end of it. Surgery is part of it, but I want this to be the motivating factor for you to be better about your eating habits, stopping smoking, because this smoking can affect your result. So those are the caveats. You do those things, I'm convinced you're going to get a wonderful result.
Thank you.
Okay?
Well, Obviously, Dr. Hurwitz, thank you so very much. Dr. Pinzone, we can't thank you enough for seeing Michael, and we are so excited for you.
Thank you.
We can't wait to see the results, my friend.
Thank you.